So let's assume here compensation took place. So with compensation, isn't it like the same thing? So supine is standing. So let's say with comp, supine is lying down, right?
Yeah.
On your back, right? Supine's on your spine, right? So with compensation, you would have an increase in sympathetic, increased simp, and you would get a vasoconstriction. And therefore, preload would do what?
Goes up.
Yeah, preload would go up, and if preload goes up, what happens to stroke volume? Goes up. Frank Starling's law of the heart, right? So I'll repeat that. Supine to standing with compensation, sympathetic activity goes up, preload goes up, and if preload goes up, your stroke volume will go up. Okay. What do you think happens to their heart rate when you go from supine to standing? Yep. So with compensation, heart rate should go up. So this is kind of nice. It is kind of replaying some of the things you learned in lecture. Deep breathing, blah, blah, blah. Anybody remember the 3 ways that blood returns to the heart? One-way valves. Anything else? Yeah, skeletal muscle contraction. So veins are found between your muscles. Yeah, skeletal muscle. So skeletal muscle contraction, right? And then breathing. Yep. So just the act of breathing is compressing on the veins like the vena cava. Okay. Okay, this gets a little obscure here, but what's going to happen to circulation during inhalation? When you inhale, your thoracic cavity gets bigger, right? What happens to the pressure in your lungs when you inhale?
Increases.
Okay, the balloon is expanded, the pressure goes down. Okay? And so is it easier for blood to flow or harder when the pressure is low? Easier, right? So what happens, so with inhalation, you actually increase pulmonary circulation. So that deep breathing, meditating, things like that is very helpful. But as a society, we're like always in a fight or flight, so we all take like these little tiny, little rabbit breaths all the time, right? Instead of taking deep, nice deep breaths. Okay. What should happen to the subject stroke volume during inhalation then? If circulation increases, what do you think happens to your stroke volume? Yeah, so let's say, well, increased circulation means the preload will go up, and if preload goes up, stroke volume should go up. Did anyone notice a change in their heart rate with inhalation? It does go up. It's called sinus arrhythmia. It's a real thing, and it's not pathological, okay? Usually kids have it, or young adults, okay? So it's called sinus arrhythmia. When you inhale air, not vaping or anything, okay? Inhale, increase in heart rate. You guys hear about a bunch of pulmonary cases that are coming up?
Yeah.
Well, what a surprise, right? You're inhaling a bunch of random chemicals into your lungs, and your lungs are just this open environment, right? Wow. Okay, so there's that. What happens to the subject? Oh, we just did that, right? Explain the effects of the deep breathing. Let's hold off on that. Like it's hairy. But just know it increases with inhalation. So what do you think happens with exhalation? It actually decreases. All right. So this is all just kind of commonsensical stuff, right? What happens to your heart rate?
Increases.
Increased heart rate. And why is this happening? There's really a couple reasons. Can anyone come up with some reasons? When you exercise?
Why does it immediately
So why would it go up when you exercise? Like even just motion.
Muscles are spinning more.
Yeah. So just even the thought of exercise, it's really just overall, it's going to increase your sympathetic activity. Okay, just motion, movement. There's a bunch of things that feeds back to your medulla, like proprioception, just movement of your arms will get the heart rate up. Okay, arm movement. Okay. So I used to do a bunch of rabbit surgeries in grad school, and sometimes when the heart rate would go down, I'd be like, the rabbit was anesthetized, we'd just move the rabbit around, and the heart rate would go up. Okay. Poor bunny. And I had rabbits as a kid, so that was always like, whoa. Okay. All right, so after exercising, does it go back to normal?
Not
For you guys?
immediately. No.
I mean, maybe not immediately.
No.
They actually say you could look up some websites. This is one of the #1 indicators of cardiovascular health. So there's these standardized tests you can do. Your recovery period is one of the best indicators of how good your heart is. So try that at home. Like if you stayed high for a long time, like several minutes, that's not good. Okay. Get thee to a gym. Yeah, so but if you have a nice recovery, you exercise, right? Alright. So
Yeah.
it really, this is a weird question. It really depends on your heart health, right? So immediately, if you're cardiovascularly fit, it will be pretty quick, within a minute or so. And if you're just like and it depends on what you guys did for exercise. I mean, did you just do like 5 jumping jacks? You're like, I'm good, so that's not really exercise. Okay, a sufficient amount. I like that. All right. Supine was what? Kind of low, yeah?
We didn't really deal with it.
Yeah,
Or did you do sitting at least?
Yeah.
You guys did sitting, low sympathetic activity, heart rate. Why would the heart rate go up? Increased sympathetic activity. Also, there's something called the baroreceptor reflex that we'll talk about. That's the final video. And we said when you inhale, what did we say happens to the heart rate? Go up, exhale, go down, and this is all sinus arrhythmia. Exercise, we said, goes up, increased sympathetic activity, just limb movement will do it. Make sense? Is that it? All right, we'll clean up your stuff, please, and put stuff in the boxes. Keep those blue boxes in there for the lab tomorrow, and then you can just kind of stack it in the closet down below.
Oh,
Okay.
is he dancing?
What do we have here? Pretty much. What's this? External jugular. I'm sorry, internal jugular.
Internal.
External jugular.
Yeah.
Now we're going in, right? So what are these, right and left? Brachiocephalic.
Oh man.
And that's going to the superior vena cava, right?
Yeah.
Okay. Coming back from the arm, let's think about that. So what's right here? That's your subclavian.
Subclavian,
Your armpit,
axillary,
upper arm, brachial. And then really it's these guys right here, right? So you got your radial, ulnar. And then look at this guy right here going all the way up. What is that? That's called the cephalic. Okay. And then on this end would be the basilic. Okay.
So
Cephalic.
is
The basilic is more on the basal part, like towards more medial.
okay. Got it.
Actually, this is on your thing too, I think. Median cubital.
Which one?
It's actually kind of both of these.
The ones that make
Actually,
it
it's more like here, because it's median, okay? But the tag is gone.
Probably on the table.
Yeah, somewhere, huh? And then, what's nice about this, too, look at this big dude.
the
Great saphenous.
Okay.
That goes into the femoral vein. And then the small saphenous up here, that goes into the popliteal. Okay. And then you have your tibials, right?
Oh.
So here's your saphenous, anterior tibial, posterior tibial. Not too bad. And then you just kind of creep up. Creep, popliteal, creep, femoral. There's an inguinal ligament, and then it's going to be the external iliac, internal iliac. That'll form the common iliac, and then you're back to the IVC. Does that make sense? Now, this even has a lot of. This actually has a lot.
Yes,
All
it
right.
does.
So check this out. There's this. Okay. Now, yeah, look at these guys. Stick dance. Okay. Here's the spleen. There's a splenic vein, yes?
Yeah.
And then this is coming from down here. What's this blue guy coming down here? Coming from like your rectum and junk like that. It's called your inferior mesenteric vein. Comes up, drains with the splenic. And then right here is your what? Superior mesenteric vein. Okay?
It doesn't have like stomach to like.
I see.
Like intestines.
Yeah, I mean you have to use imagine that there's intestines here. Use your imaginoscopes. Yeah. So you got your small intestine, like your rectum and your sigmoid here, and that's going to be your hepatic portal vein. Yes. That's going to go up into the liver, hepatic portal. You know, you have. Here's something not too bad. What about this? So those are your renal artery, renal vein.
Does that one have the adrenal ones too?
The adrenals are actually not on here very well. Oh, it's in the back. So here's the adrenal gland. I'm not going to tag it there. It's way too small.
Are you gonna do the blockage stuff?
Maybe for the head one. The head one. 'Cause I'm not going to do any other. Let me think about that. All right. So what else? So what would be the red then? Inferior mesenteric artery, superior mesenteric artery, and then you can actually even see this. See the three coming off? That's a celiac trunk, right? The big ones are splenic artery, common hepatic, and coming up here should be left gastric. Yeah. All right.
The gastric one's not on.
The gastrics, they're actually on here too. So if you imagine your stomach is here, see this little loop right here? This would be like the left and right gastrics. And then there's a loop down here. What are these? The left and right gastroepiploics. Yeah. Gastroepiploic. It's on the bottom edge of the stomach. Okay. I mean, it's we're just like, that's why we're reviewing, right? Let's go back here. So what is up here? You have what? Azygos on the right.
Okay.
And then this would be your, yeah, your